So as angina persists and the chest pain is no longer relieved by the 3 administrations of nitroglycerin, at that point the patient's probably having a heart attack. So in regards to us finding out is the patient having a heart attack or not, we must assess the cardiac enzymes. And cardiac enzymes are blood markers. They're chemicals that are released into the bloodstream every time the myocardium infarcts, when it dies off. And what I like to do is I like to think of cardiac enzymes as like the spirit of the heart, because every time we die, we believe that our spirit leaves our body and it floats out to, or down there, right? My point is though, when your myocardium infarcts, when it dies off, when it becomes necrotic, well, it also releases a substance, and that substance we call cardiac enzymes. We have quite a few. The first one I'm going to discuss is the one that we utilize most clinically, and that's known as your troponin levels. Okay? We get a better marker. And so when it comes to your troponin, we have troponin 1 and troponin T. Okay? It's important for us to understand that when it comes to troponin, we love to use that one more so because it provides more clinical data. It gives us more information because it stays elevated for much longer, and the onset time is relatively fast. So when it comes to troponin, the onset time, meaning the amount of time that it takes for it to be present in our bloodstream, is as early as 3 hours. Okay? And then generally speaking, it reaches its peak anywhere from, depending on which one we're talking about. So we're talking about the peak times, okay, of your troponin I and your troponin T. The peak time for the I is going to be somewhere between 24 to 48 hours. And then when it comes to your troponin T, look at this, 72 to 100 hours. But the thing that's most clinically significant is how long does it stay elevated for? So we want to really keep in mind the duration. How long does troponin stay elevated so we can gather more clinical significant information? Keep in mind that the troponin I is elevated for about 3 to 5 days, and the troponin T, in some books, it's up to 15 days, but keep in mind that duration is up to 15 days. And the reason why we like to look at troponin is simply because it gives us more data, it gives us more information. The onset time is relatively fast, and we can monitor it and see if the medication that we're giving, if the medical treatment is actually helping the patient out, and then the troponin levels should be stabilizing after that. Another cardiac enzyme that we have is known as CKMB, creatine kinase myocardial bound. This one also, you have an onset of about 3 hours, okay? And that's significantly important. However, its duration, and that's really what I'm going to focus on right now, its duration is relatively limited. It's only elevated for up to 72 hours, only 3 days. So there's limited information that the CKMB can provide for us, although in a cardiac panel, we're still going to be assessing it. And then we have lactate dehydrogenase, LD. And so when it comes to the onset of lactate dehydrogenase, we're looking at 8 to 12 hours. You see, this is the problem with LD. It takes so much time for it to start elevating in the bloodstream that we don't really know, is the patient having a heart attack or not. So that's why troponin provides more clinical data, and that's why we usually go to troponin to find out what's going on with the patient. The peak time for lactate dehydrogenase, is going to be usually 8 to 14 days. Now, that's helpful. The problem is the onset is limited, so that's why we tend to go with troponin. Keep in mind that when the doctor is trying to differentiate whether somebody's having an MI or just myocardial infarction, the doctor will do a panel of all of these, including something called myoglobin. And myoglobin, its onset time is as early as 1 hour, and their peak time is about 6 to 9 hours, but it's only elevated for about 1 day. So again, you have limitations. Keep in mind these lab values, folks. Troponin is the cardiac enzyme marker that we really want to look at when somebody is suspecting of having an MI. And to rectify these issues, we can give medications that are known as thrombolytics. And thrombolytics are a little bit different than your blood thinners because thrombolytics, making sure I'm spelling this okay. So thrombolytics are medications that dissolve a blood clot. So we can give something called streptokinase or streptokinase or TPA, tissue plasminogen activator. These medications dissolve blood clots, and so that's what's actually gonna decrease the infarct, the damage to the myocardium, because these medications dissolve blood clots. Another thing that you guys should keep in mind when someone's suspecting they're having a heart attack is to assess the D dimer, because the D dimer is an element inside the blood that's going to be elevated when when their blood is hypercoagulable. So that means that they're having a lot of blood clots, and if you're having an MI or DVT or any excessive coagulability, the D dimer should be assessed because it will indicate that the patient is having a heart attack.